All right. Well, hi everyone. I'm Kacie Craig, the Executive Director for the Acute Syndrome Foundation. Thank you for joining us on the TCSF Meaningful Change Roundtable discussion this afternoon. I am so excited to welcome our special guest panelists. Please join me in welcoming Marianne Sutcliffe, Dr. Ina Hughes, Dr. John Schreiber, Carolyn McMicken, and Svetlana Shore. I would like to thank you all for joining us today and the full Neurocrine team for your collaboration and financial sponsorship of this TCSF panel. Everyone has joined us here today to provide their own perspective on what meaningful change means to them. You will also be hearing from Neurocrine team members, Carolyn McMicken, who will provide a clinical outcome measurement and patient-focused drug development perspective, and Svetlana Shore, who will provide feedback from a clinical development standpoint. As a reminder, we will not be discussing specific details about active clinical trial research or participation, but we'll be sharing the latest status of the Neurocrine SCNAA clinical trials and what these investigational treatments might mean for our SCNAA patient community. The views and opinions expressed by panelists who are not employees of Neurocrine may not reflect or represent the views or positions of Neurocrine. Okay, so before we move into our discussion panel today, let's get to know our panelists a little bit better. Marianne, would you like to go ahead and get us started by introducing yourself and telling us what perspective you bring in today's discussion?
Sure. Hi, everyone. For those I haven't met either on the Facebook page or at some of the gatherings, Marianne Sutcliffe. I am a caregiver, a mom of Brianna. Brianna is 7 years old. And she has an SCNA mutation. She began having seizures at 5 months, and at 11 months, we received her diagnosis. From there, about a year in, she was controlled. She was seizure-free for almost 5 years, and just on oxcarbazepine with, a couple tweaks here and there. And so all of my focus was on her development. She is one of the luckier kids in terms of development. And about almost a year ago now, the honeymoon was over, and we've been trying to find control for Brianna again. She's now on 4 meds and is still having seizures every day, and at least one rescue a day. So I'm here as a caregiver. I also am a volunteer for the Acute Syndrome Foundation and am on the advisory board for the Acute Syndrome Foundation. So I look forward to being here. Thanks.
Thank you, Marianne. We appreciate you being here and giving us your perspective. I think it's a very unique perspective where you've had periods of control and then now finding yourself not under seizure control. And I think that's a really interesting perspective. So thank you for being here. Dr. Ina Hughes, so good to see you today. Would you like to introduce yourself?
Thank you. I'm really excited to participate with you guys. My name is Dr. Ina Hughes. I am a pediatric epileptologist at the University of Rochester in Rochester, New York. Through a very happy accident of geography, I've gotten to meet many really wonderful SCN8A spectrum kids across the entire spectrum of gain of function, loss of function, intermediate function kids that live here in upstate New York in our epilepsy center. And it's been an amazing opportunity to get to work with you guys.
Thank you so much for being here. I know I'm just going to shout out too that you had to really work around some schedules today to be here. And so we really appreciate you taking the time. I also want to mention that we will have Dr. John Schreiber here with us later today. He is no stranger to the SCNAA community. He is the director of the Epilepsy Genetics Program and EEG at Children's National Hospital. He had a guest lecture today until 12:30, but he will be joining us as soon as that is over. So once he pops on, you'll see him pop on and we'll make sure to get his perspective as well. All right, next, Carolyn McMicken. Good to have you on screen with our community again. Would you like to introduce yourself?
Sure, thanks, Kacie. Carolyn McMicken. I am a director in clinical development at Neurocrine, focusing on neurology and rare disease. My background is as a neuropsychologist, and that's why my perspective is and will be a lot about how we measure meaningful change in the context of SCN8A, and can be broadly, I guess, generalized to other DEEs as well. And I'm happy to be working with my colleague Svetlana. So I'll let her introduce herself as well.
Sounds good.
you. My name is Svetlana Shore. I'm also a director of clinical development at Neurocrine, and I'm the clinical lead of our pediatric epilepsy programs. Some of you may have seen me at the annual gathering at AES in December. So if that's you, nice to see you again. But for those of you that haven't heard from us before, just wanted to take a couple of minutes to let you know about what Neurocrine is doing, why are we here, and then I'll hand it back to Kacie to jumpstart the roundtable discussion. So at Neurocrine, we're developing a drug that we refer to as NBI 921352. It's a very long name. Many of you, if not all of you, have heard of this drug. It used to be called Z901. Neurocrine licensed it from Xenon a few years ago. It's an investigational product. It's a sodium channel blocker. The way that it's different from other sodium channel blockers that are currently available is that it blocks only the sodium channel subtype 1.6. And this is the subtype of sodium channels that's affected by SCN8A mutations. SCN8A is the gene that codes for the channel 1.6. And so for children that with developmental and epileptic encephalopathy related to SCN8A, it's usually a gain of function mutation. And this is a sodium channel blocker for 1.6. So we're developing it as a treatment for patients with SCN8A DEEs. The study to evaluate this drug is called the Kayak study, and you can learn more about it or sign up on kayakstudy.com. And it's for patients between 2 and 21 years old with SCN8A DEE. We've actually already enrolled 8 participants, and they finished the study, in fact. And it was a huge milestone on everybody's part, not to mention the patients themselves and their families. So we have the first group of 8 that have completed the study. We refer to this group as the Sentinel cohort. And the way that the program was planned is that we would enroll these 8 and then we would pause so that we could evaluate the data and essentially check to see if anything needs to change before we continue with the study. So that's where we are right now. The 8 participants have finished the study. They're actually in the open label portion, which means it's not like a double blind with a placebo and active. They've actually moved on to open label where everyone's receiving the active drug. But we're currently in enrollment pause while we review all the data. And so that's where we are right now, and hope to come back soon and be able to provide more updates. So thank you for thank you for listening to our update.
Sounds good. Thank you, Svetlana. All right, well, we have a great group and I'm excited. I think this is going to be a lot of fun. So let's actually get started with our first question. So the question is, what is meaningful change? More specifically, from your perspective, whether that's a caregiver, clinician, or clinical researcher, how would you define meaningful change for SCN8A families? And let's go ahead and get started with caregiver Marianne.
Hi. Well, I think a lot of us can relate to this question. There's so many ways that we could see meaningful change for our children and our families. One would be that there was truly a standard of care for treatment of our kids, or if not a broad standard of care, something even more specific for each of our kids based on their variant, so that the process doesn't have to be so much trial and error. Because definitely a learning from this whole process is that, it is truly an art, not a science. And what works for one child sometimes doesn't work for the next child. And we learn from each other and our population as much as we do from our physicians. I think meaningful change here would be that there's so much more awareness by the pediatric neurology population about SCN8A, so that no matter who you go to, there's a knowledge about what types of things work, what types of things don't work. I remember Brianna being in the hospital last winter and someone trying to give her Keppra for her gain of function SCN8A. And if I hadn't intervened, that would have been the case. So want to make sure that, there's much more knowledge. And I think, you know, if we could get to seizure freedom, or at least good seizure control, we could focus on the development of our children, no matter what that looks like for each individual child. Every child is different and affected differently, but if we could focus on development versus always worried about seizures and even SUDEP, I think we would be in a much better place from a meaningful change perspective. And I just want to add one more thing, which is meaningful change would be that Brianna's sibling didn't have to see her sister have seizures at such a young age and know what the word seizure even was. So.
Yeah, the sibling aspect of this is always a complicated one too, right? Because they are so much a part of our families, and they see the everyday that no other kid should have to see. And then our affected kids, obviously, having to deal with it every day as well. I know many times Lincoln has woke up in the middle of the night to our entire living room filled with firefighters and paramedics, and then we're shipped off and he has no idea if he's going to see us tomorrow or in 2 weeks, because we might be in St. Louis. So I know, and when we think about meaningful change, and that's kind of something on my end of a spectrum for caregiver too, is having less of those episodes would be nice, right? And so if we can have less of those life altering traumatic events, that would always be very nice to be able to get those out of the picture. So let's move on actually to Dr. Ina Hughes, one of our clinicians. What about you? What's meaningful change mean to you?
The toughest thing is, just like you guys said, meaningful change is so incredibly individual to each family, right? There are some families, thankfully with SCNA, that have a relatively low total seizure burden. Every seizure stinks. I'm never going to tell you that it doesn't, but their goal for that kid is not necessarily, you know, fixing every seizure. It's making sure that you don't end up in the hospital during an illness, or that we can make sure that their PTOT and speech are in the ways that they need to be, so that they can actually achieve the goals that they want. And importantly, sort of like what Marianne experienced, those goals are ever shifting too. And so whatever target we decide on today may not be the right target, you know, even a couple of weeks from now. As a clinician, trying to make sure that we are meeting our families where they are and meeting our patients where they are is always a really ever shifting target, but is one of the most important things that we can do in peds epilepsy and peds neuro in general.
I love that. Working with the families one-on-one, and then also being adaptable to being able to switch the focus if need be, I think is super important. So Dr. Schreiber isn't on with us yet right now, but we actually reached out to 2 clinicians that are also pretty familiar with the SCNA community. And so I have written responses for them. So Dr. Scott Perry, response to what does meaningful change mean to him? So he said, great question. I'm not sure meaningful change for SCNA families is something for the clinician to define. I measure meaningful change depending on the goals of the family and the patient when it comes to treatment. That may be a goal for some percentage of less seizures. Maybe it's less of a certain type of seizures. For example, one associated with injury or needing rescue meds. Maybe more alert and on less meds, or sleeping better, eating better eye contact, some type of developmental skill. This all depends on the family and the patient, much like you were saying, Dr. Hughes. My job is to ascertain what their goal is, help them define what it is like, what's likely reasonable, and what may be possible. And then also what's a stretch, and then discuss the ways that we can go about trying to achieve the goal. So meaningful is defined, but what brings satisfaction to the patient and the family, improves quality of life, etc. So I think that's a great point to make. And it's essentially kind of what we were all talking about as well, is trying to figure out what that target is and then working towards that goal, but also being adaptable. And then Dr. Joseph Sullivan also gave us response, and his says, meaningful change is any consistent observed improvement in the patient's daily function that is unexpected based on that patient's prior development trajectory. This could be something such as improved head control or improved awareness of their surroundings, which are changes that may get lost in many of our routine clinical assessments. And I really like that last sentence that he mentioned there too, because I know a lot of times when I try to fill out a quality of life survey or some type of document, it looks like she's made no progression whatsoever at all. But when I sit there and I talk to her, our epileptologist or her therapist, and I'm telling them, little inch stones, the little things that she's doing, it does get lost a lot of times in that assessment, but it's so important for us to realize those and really hold on to those things. All right, Carolyn, what about you? What's your take on meaningful change?
Sure. And so I'll leave some of the more specific kind of clinical trial environment answer to Svetlana. But like I said, so from the perspective of figuring out how to measure what's meaningful, I echo what's been said so far, that really we are relying on the patients and in most cases with SCN8A, the caregivers, to help us define what's meaningful. And we've evolved from a place where, especially in more prevalent conditions, that really this was defined by the clinician. The clinicians decided what they thought was going to be a meaningful change from a medical standpoint. And in rare disease, and especially SCN8A, it needs to be really focused on the patient. Luckily for us, the FDA has really recognized this in the past several years with an increasing number of guidances on how we measure meaningful change. And one of the first steps, especially if there's not a well-defined thing to look at. So in the case of SCN8A right now, for our purposes, it's seizure control. But if we think about the things that are non-seizure related that we know are very important to families, one of the first steps we can take is to learn directly from the caregivers. What are the things that are most bothersome that these children are experiencing, and what would be meaningful in a change for any of those different aspects.
Yeah,
so I'll leave that there, and lots more to say, but we can elaborate as we go on in the conversation.
Sounds good. And before Svetlana goes on, I wanted to mention to our families at home, feel free to leave some comments in the chat box. If you would like to add to our discussion at all, you are more than welcome to do that. I believe the chat box should be up and running, but sometimes with the webinar style, it can get a little wonky. And so if it doesn't show up in the webinar as a chat, you're more than welcome to put it in the Q&A and I can look at it there. All right, Svetlana, what's your take on meaningful change?
Yes. So from a clinical trial perspective, it's actually really difficult to define it in a trial because of what everyone just said. It's so individualized, what's meaningful for you. But in a trial, the way that the data is analyzed is it's group-wise. So you take all the people, at least in a randomized trial, right? You take all the people who get drug, all the people that get placebo, and you take averages of those groups, and you compare those averages. So it's difficult because you have to find something. If in the trial you wanted to say the difference in this trial was clinically meaningful, it has to be something that's defined up front. For example, in epilepsy trials, very commonly we use 50% seizure reduction as that's almost like globally clinically meaningful. So you could say, here's the number of people in each group, or the percentage of people in each group that achieved 50% seizure reduction. And so you could set something like that, but it's specific to indication, and 50% seizure reduction may or may not be clinically meaningful to you as a caregiver or as a patient. So we really, really do rely on that feedback from caregivers, from clinicians on what could be globally meaningful in a trial. So that's one thing, sort of setting a threshold based on feedback from the people affected by the disorder. The other thing that we commonly do is we actually ask you questionnaires like, how much do you think your child improved since you started the trial? And you could say very much improved, very much worsened. And we'll use your actual direct feedback to say, well, 50% of people said they were very much improved in this trial. And that's a meaningful, very much, it's certainly a meaningful change. So you do have to define it up front, and you have to be careful, because sometimes trial results, what we report in, the media, it's what's statistically significant. And all that means is that it's unlike, very, very unlikely due to change. It doesn't mean that, chance, very, very unlikely due to chance. It doesn't mean that the difference that we detected is something that's going to change your quality of life. So it's really important that these conversations occur, so that when we define our trials, we're able to measure those things and report on those things that would be meaningful to you as clinicians or caregivers.
Great points. Great points. All right, we're going to move on to our second question. Why is it important to have conversations with caregivers and clinicians? Marianne, we'll start with you again.
The way that I view this question is, why is it important for the clinicians and the families and the patient, and not the patients, but the families to talk? And I think the point to me is that we all have something to bring to the table. We have the practical knowledge of what we see in our child every day. And I think the point that many of you made about our goals might be different. Our goals might be, I don't want my child to be sleeping all day, so it's not okay that she's sedated. I want her to be able to participate in her life as well. So where's the happy medium to, seizure reduction and development? And I think the other thing is, particularly in our community, I learn as much from what everyone else in the community has gone through and what they've even heard from their physicians, so that we can share back and forth and even connect, physicians based on what they've experienced. That I think there's no way to just do this in a vacuum, whether it's from, the parent's perspective or the clinician's perspective.
Absolutely. I'll also just kind of add to that too. I find it sometimes frustrating because Miss Stella will clam up when we go to a doctor's appointment. And so we show up, and I've just been talking about how well she's doing. And then she doesn't make a sound. She doesn't smile at her. She doesn't do anything. She might even have a seizure right in front of her. And I'm like, Stella, come on. Like, we were just talking about how good we were doing. And so one thing that I like to do is, in between, we see our epileptologist every 3 months. And so in between that, I like to send videos and pictures of when Stella is doing well. So I feel like oftentimes we only have those conversations sometimes when they're doing badly, when they're doing poorly, when they've had multiple seizures or they're sleeping all day. And so I try to throw in those nuggets of, look, Stella lost her first tooth and she's smiling, or, on Halloween, things like that. So where she's seeing the good days. And I always try to have a nice video, if I can, of when Stella is on, right, and her really good days. Because when we do end up in the hospital and they say, we have a new set of doctors in the PICU or wherever, and they say, is this Stella's baseline? I can show them that video and say, nope, it's not. And this is our goal. This is where this is what we want. And so having those conversations and making sure that they are aware of both sides of your child when they're doing well and doing poorly, I think is important. All right. So Dr. Hughes, what about you?
So I gotta say, as a clinician, those sorts of communications make our day so much. And also that's incredibly important, because your child is not the only one that either plays possum or does the singing frog phenomenon and only does one particular thing in front of their neurologist. Right. Or decides, like, you're not my friend, I'm not playing interacting with you. We get that a lot. And so getting to see your children at a time when they are feeling well, doing well, and doing the things that we are all proud of is incredibly joyful for us. And also, like you said, helps us to get the correct targets, right? So everybody has bad days in epilepsy, and we never want anybody to be judged on their worst day, except for their IEP goals. We do want the IEP goals to always be written for what your cruddiest, most miserable day is, so that there's always the right supports in place. Mm-hmm. I think one of the other big things is that, like you guys said, everything shifts and changes with our kids. And I think one of the biggest utilities that we have as an ability to communicate is that you guys are seeing your kid in the situation that you are in. And while there are lots of very important features that are very specific to SCN8A, I think the thing that epileptologists and neurologists can bring is that we also know that there are lots of commonalities with many other complex epilepsy syndromes. And the places that we can bring those things together and say, okay, this is a unique situation to SCN8A, and here's what we can learn from that. But here's what we can take away from the larger epilepsy community and the larger developmental disabilities and intellectual disabilities community, and bring that to help and support you guys and to connect you to larger and smaller organizations, I think is one of the utilities that we can, again, have by having these cross-disciplinary kind of conversations.
Yeah, I think that's great. Looking at global, what are we learning globally? But also looking at the individual needs of each family and child. I think that's great. What about Carolyn? What about you?
Sure. Well, first of all, again, the families are the experts in this condition. And then, of course, our clinicians also develop expertise. And I really appreciate what Dr. Hughes, you just said about, you have experience with the SCN8A population, but then the broader epilepsy and DEE community. And, we rely on you to help us with that. Earlier on, the last part of the discussion, Marianne said something about, art versus science. And, in pharmaceutical research, we need to kind of apply a scientific method to the art when it comes to identifying what's important. And we can't, we really appreciate the efforts that the community already has put into sharing information through registries and questionnaires to help us really inform the research that we're doing that will hopefully ultimately benefit the community. So we can't do that without this broad partnership with patients, clinicians, and researchers.
Agreed. Absolutely. Svetlana?
I'll echo that as drug developers, it's critically important for us to, and even expected, the regulators expect us to get feedback from caregivers and clinicians treating the disorder of study. So you can't get around not speaking with the families or the clinicians. And for us, that feedback is used in two big ways, lots of little ways, but the two big ways is one, as I kind of mentioned before, defining what's clinically meaningful. You can't just develop a drug that has an effect, but it's not meaningful to anyone. So we have to have those conversations to be able to define and interpret our study results. And the second big way is actually in the design of the trial, choosing what type of people to include, because many of the epilepsies are spectrum disorders, and so there are choices to be made about who to include in the first trial, in the second trial, in the third trial, and also how to measure the effect of the drug. Are we just looking at seizures? Are we looking at development? So in those two big ways, it's actually critically important and expected for us to have those conversations from a drug development standpoint.
And I would say that I would think the conversations between caregivers and clinicians is extremely important to even decide on if they want to enroll in a clinical study as well. Having those conversations and discussions prior to, exploring that and signing up is really important.
The one other thing I do want to add is that the opportunities for not just our clinical team at Neurocrine, but the broader team that's working in epilepsy, to hear from, people like you, Kacie, coming to our meetings and telling us about Stella. It's highly motivating. It helps us kind of put faces and real people in our everyday work. And I know that the team appreciates that as well.
It was such an honor I believe it was in September, when Shelley and I were able to come to the Neurocrine offices and do a lunch and learn and talk about our kids and our journey. And it was just an honor to meet everybody on the team. And I think like you said, it motivates everyone to, when they get to know your kid a little bit more and the daily things that we go through. Absolutely. All right, so if we move on to question number 3, this year's theme for Meaningful Change series is From Surviving to Thriving. How can you connect this theme to meaningful change for SCNAA families? Marianne, we'll start with you.
Sure. I think, as a parent, we're always second guessing ourselves, right? So I'm a parent, as many of us are, a parent of a typically developing child without a chronic health condition. And then I have, Brianna. And as a parent, we're always second guessing ourselves. But I think with SCN8A, there are so many things to second guess ourselves about. And so I think thriving would be to have fewer things that we have to question, that if we knew, we had the right treatment, we had the right approach for the seizure side, then we could focus more on things that would help, with development and allow our kids to reach higher heights than we would have maybe thought they could have been able to. I think that would allow them to thrive more, for the whole family really to thrive more, if we, weren't up at night because we're worried about suit up and not getting a good night's sleep, and trading off, my husband and I spending the night with Brianna so that, we can keep that one extra eye open. And I think, surviving to thriving would be to not have to hear about and know about and face, as some of our families have, losing a child, and being worried about losing a child. I think, getting to more control and having a treatment that would allow us to focus less on the seizures, I think would be amazing for all of us.
Yeah, less trauma in general, right? Less trauma to us, our kids, and our family. Absolutely. And I think it's so important too, like we talked about, having those conversations with your doctor too, so they know what are your top priorities. So you feel like now I'm actually transitioning from surviving to thriving because of X, Y, and Z, because my child's sleeping better at night, or they're having better seizure control, or I don't have to worry about them, being safely eating or something like that. I mean, everybody has their top probably 5 priorities. And so I think it's important for us to share those and feel like we're on a team together, right? That I'm not fighting this alone. I have a group of people that are behind me, and we're all fighting for the same thing. Absolutely. Dr. Hughes, what are your thoughts on From Surviving to Thriving, and how this meaningful change plays a part in that?
So one of the things we try to teach our residents here is to ask the question, what keeps you up at night as a parent or as a caregiver? Because that gets to a lot of the things that you guys are talking about. And if we can't address the stuff that is giving you high anxiety and is the thing that is stuck as the most important thing to work on, and we're not addressing that, then we're not doing our job to help you guys and to help the kids that have the seizures, or to have the differences in development, or whatever it is that is giving you trouble. And so that's an incredibly important thing for us, I think, all to work together on. I think one of the biggest aspects of thriving too is recognizing that for some of our kids, the idea that we will ever make them seizure free, it doesn't match with the kid. It doesn't mean it's a goal that we're going to give up on. We always strive for that goal, but it's also fantastically important for us to also make sure that we're always moving forward all of the other goals of giving a child a chance to live the life of their choosing, whatever that is, and in the best way that is possible, so that you can have the best quality of life on every other day and every other moment when a seizure isn't happening. And that's a really tough thing to do, and it changes and shifts just like everything else that we've talked about. And I wish that there were beautiful, concrete, simple answers. But we do need to do a lot of tailoring for absolutely everyone. And that's something that we keep working towards.
Absolutely. Something that just kind of came to mind as I heard Marianne and Dr. Hughes talking is that, what's keeping you up at night? And is this one of your top priorities? Because what Marianne was saying, we have this horrible amount of mom guilt, right? Of all the things we need to be doing. Oh, she needs to be in her stander for 10 hours. Oh, we need to work on this. Oh, we need to work on that, and this and that. And I know at one point in time, we were really having a hard time gauging Stella's hearing, and was she hearing properly? And she can't use a normal hearing test and all these things. And we had the hearing aids, she hated them. And finally, an audiologist said, is this in your top 7? I'm like, not even close. She was like, then if it's okay with you, are you happy with where Stella's at right now without hearing aids? I'm like, yes. And she was like, then take it off your plate. Stop worrying about that. It's not even in your top 7. Let's move on. Let's work on something that is in your top 7. And that felt so good to me to have a professional say, it's okay that you can't do it all. So let's pick your top, 5, 3, whatever, and work on that and move towards that. So I think that's just kind of marry both of what you guys were talking about there. Carolyn, what are your thoughts on this subject?
So the word survive versus thrive, it makes me think about, again, the guidance that we receive in industry and we talk about with clinician researchers all the time, is that if you're defining meaningful change, it's a change in how somebody feels, functions, or survives. So, and you can kind of tackle those separately or all together. But I think back again, Marianne, I think at the beginning of this discussion, you talked about, okay, maybe we want to focus on getting seizure control, but then hopefully we'll stop worrying about that, and we don't have to worry as much about SUDEP or at all, and we can focus on the development, which is really around how your child is functioning in life. So I see, hopefully the promise is that with new treatments, we can move beyond worrying as much about the survival aspect and improve functioning, which, as a parent, that idea, I'm just surviving, hopefully if the functioning's improved, then you can move beyond that feeling of just constantly trying to play catch up as a family, as a caregiver, and, for your child.
Yeah, being less in that emergency mode all the time. It would be nice. I'm sure all of our cortisol levels are extremely high as we're constantly in that fight or flight mode, right? Svetlana, what do you think?
Yeah, I mean, I think exactly. I think, the very first priorities are, reducing mortality, reducing those medical emergencies. And it's like the pyramid of needs, first, where everyone's focused on survival. You have to be able to survive. And the same thing in drug development, the drugs that get approved the fastest are the ones that, when you have a high mortality and you're trying to prevent that. But I think we would all agree that the ultimate goal here is to progress treatment such that those aren't the only drugs we're developing to reduce mortality and prevent those, huge medical emergencies. But if you would, as a caregiver, have enough control, like the treatments are progressed such that there's enough control that you could take a short weekend vacation. I mean, that's thriving, right? You still have a child with SCN8A, but can you get away with, your husband or your other family for 2 days and leave your child with someone else? I mean, that to me, I think is where we want the treatment goals to get to. It's not just about preventing death. It's so you can live your life while being a caregiver.
Absolutely. I couldn't agree more. All right, we're going to move on to question number 4. What does the future look like for the SCN8A community? Where are we headed? All right, Marianne, you're first.
I think the answers here kind of overlap a little bit. We're excited for the fact that there are drugs specifically developed or being developed for SCN8A or things that maybe don't have the same side effects. Obviously, we don't know any of that yet, but don't have the same side effects as some of the broader drugs, so that we can maybe not have these periods where the honeymoon's over and then we have to start again. And so I think it's exciting for such a small community to have a couple of different drugs being developed for this population. And so I think everybody is really awaiting, what comes next there. I think we can't stop there. I think, precision medicine, and I'm not the clinician or the researcher, but precision medicine probably will still be something that's needed in the future and hopefully will be the next step. And, I think some of the things that even our community is working on with supporting our community with how can we thrive and not just survive. Some of the support mechanisms that we are bringing with, with Neurocrine support as well, so that we can focus on, like you said, Svetlana, living our life. When that's exactly how I put it with Brianna's change from controlled to not controlled. It's like our whole life has changed. We're not living our life the way we lived it before. She's missing out on much of her life now, and that's not what we want for her, and that's not what we want, obviously, for our family. So I think the future is really about not just having to measure those little inch stones, but maybe being able to measure feet or even miles, big development goals for our families, instead of just these little bitty things that we should take for granted.
Mm-hmm. Yeah. One thing I'd like to highlight in this little section right here is that being executive director now, I'm able to go to different conferences and talk to other foundations, and seeing where we have came really just in the last 5 to 10 years is huge. It's remarkable how quickly. I remember my very first gathering and hearing from some different drug companies and thinking, wow, are they actually thinking about our small little community? And now we're here and we're in it, and it is just absolutely remarkable. So that gives me a lot of hope, knowing how far we've come in the last 5 to 10 years, and maybe where we are going to be in the future. What about you, Dr. Hughes?
I think some of the biggest things that are fantastic help to us is, one, getting to know you guys as a community, and also getting to know some of the work that you're doing that helps us to better identify faster which kids may be kids with SCN8A related epilepsy or developmental differences, so that we can do things like make sure that we don't accidentally give them meds that make things worse, that we specifically target towards choosing medications that specifically make them better, and help them to live their lives better with fewer side effects. And those guidelines that you as a group have contributed to making have been huge. And I think as we continue to get more of those guidelines across more of our DEE communities, we'll be able to better target children faster, so that families don't have to hang out without a diagnosis for months or even years and not know how to get targeted therapies, or not be able to be identified for the things that they need and the associated things that might match with what a specific condition has. Do we need to check EKGs on everyone? Are there subsets of kids that we need to do that for? Or do we need to make sure that everybody is getting a hearing evaluation or a speech evaluation? Some kids yes, some kids no. And having that information has been a really big help, and I think is one of the things that is really moving the treatment of epilepsies much further ahead, much faster.
Absolutely. I would have to agree. Carolyn, what are your thoughts?
I think that the parent or caregiver input is going to just continue to be as important, if not more and more important, moving forward. I see a lot of promise. Like you said, it's, the SCN8A community has come so far in a short period of time, and we hope to keep the momentum. I see hopefully better treatments on the horizon, and better ways to measure that meaningful change. There's so much work being done in collecting longitudinal data about all different variants of SCN8A and how children are developing, and that helps us to really understand not just how to treat the patients, but also how to measure the changes against what we would expect without any intervention.
Yeah, exactly. Svetlana, what are your thoughts?
Yeah, I think that there is hope. I think that we've already seen what I think of as pretty big changes, and it's continuing to do so. In the near past, the anti-seizure medications were developed and approved based on seizure types. And they're still used that way today. There are drugs that are used for tonic-clonics. There are different drugs that are used for absence, and it was just based on seizure type. But as you know, completely different epileptic syndromes that have those seizure types, you don't use those. And Keppra in this instance, as you all very well know, was an example. So we have already changed in drug development from developing drugs for a single seizure type to more syndromic. And in the past, I guess in the past 10 years, there have been many drugs that have been approved for syndromic purposes, so that, you know, you're not just as a physician always just guessing. There are drugs developed for this disorder. And obviously we see that here, our study for SCN8A, there's another study that has started for SCN8A. And it's just so, to me, very hopeful, very nice to see that there may be in the next 10 years drugs approved specifically for SCN8A, which is just such a departure from how drugs were developed in the past. Epilepsy drugs were developed in the past. So I think, you know, I think I hope that that's where we continue to head, where it's not just, you know, one tonic seizure fits all. It's syndromic, it's specific. And I think that you guys having this community and increasing the volume of your voice, people hear it, FDA hears it, drug companies hears it, and then the drugs are developed for your community. So I think the future is hopeful, and we are all moving in the right direction.
Yeah, I would agree. Hi, Dr. Schreiber. How are you today? I know we had
good. Just on call as well. Thank you.
No worries. We're glad to have you. And I wanted to actually just kind of back up a little bit and give you an opportunity for you to share what you believe meaningful change is. And from your perspective as a clinician, how would you define meaningful change for our SCN8A families?
I think in a number of different ways, right? Because I talk to families, and oftentimes seizures aren't the number one thing. It's often our, you know, primary outcome that we're looking at in a clinical trial. But realistically, and I think it's something, you know, Neurocrine recognized in this trial, is that there's many other things that factor into that. You know, we're finding a lot of families have participated in some of our work on quality of life most recently, and we're finding actually that really best correlates with development. It does correlate some with seizure frequency and phenotype, you know, so does your child have a more severe or less severe form of SCN8A. You know, knowing that regardless of how severe the phenotype is, it's going to impact your child's quality of life and your overall family quality of life. But one thing we've also found, maybe a little surprising, I think it's been reported in other populations also, is number of medicines also correlates with that, right? So, you know, realizing that sometimes, you know, adding another medicine that might have a tough side effect profile may not be the best choice for your kid, and that, you know, may actually indeed worsen quality of life, because now you're having to deal with all kinds of different side effects. So meaningful change, as I see it, is, you know, change in terms of seizure frequency, you know, sure, but also seizure duration, status epilepticus, and then all these other non-seizure things. So development, behavior, medication side effects, comorbidities, you know, all these things we give can also cause other symptoms and problems. And then, you know, SUDEP risk and risk for other mortality and other problems also. So we can give something that's impactful in that sense and limit side effects. I think we're going to see more of an impact on life and quality of life.
Yeah, I know this has came out of my mouth several times when Stella was having horrible side effects. It was like, you know what, I think I could deal with the seizures. I can't deal with these side effects. And we would have to switch or change directions because of that. So I can definitely relate to that. I will kind of recap a little bit from where we were talking about too. Why do you feel like it's important for conversations with caregivers and clinicians to happen? Dr. Schreiber.
In terms of just overall care or clinical trial, or
I could say, I think either one. You know, we talked a little bit about as far as being on the same page and making sure that we're all hitting those top 5 goals or 3 goals of what are the families are needing. But maybe you could hit on terms of a clinical trial if they were interested in a clinical trial. You know, why are those conversations important?
Yeah, so you know, anytime I you know, meet a family affected by SCN8A, we're often having that conversation. You know, what are your goals? Because it's not always evident, right? It's not as you alluded to, as we've been discussing, it can be different according for each kid and for each family. In terms of a clinical trial, I think that kind of question comes into play when you're considering if someone might want to enroll in a clinical trial. What are we looking for in terms of a clinical change? Is this something that you are comfortable with, knowing that there's a chance to get medicine, a chance to get placebo in that first part of the study? Is it something that's potentially safe? Are you in a good place to do this right now? In terms of seizure stability, if it's a child who's going into the hospital, a lot, at the time, it may be better to, wait until someone's in a more stable place to consider something like a clinical trial. Just knowing that we don't know exactly what your child might be receiving in that first part of the study.
So yeah, it definitely sounds like having those conversations, asking those questions. That way you and your physician both feel comfortable moving forward and having those conversations. And then one of the questions we actually just wrapped up with, but I'd be really interested to get your perspective, Dr. Schreiber, is what does the future look like for SCNA community? Maybe when you think of 10 years down the road, what are your thoughts?
I think seeing more precision therapies come to the fore I really hope are going to be impactful in terms of overall, life, quality of life, seizure frequency, everything there. There's been lots more research going into SC and 8A in general, and we've seen that, pay off for other kinds of epilepsy. We've seen it pay off for 8A as well already. I also take care of lots of kids who have Dravet syndrome, as many who see people with genetic epilepsies do, and it's really been tremendous to see the changes that have taken place in that community over time, just with all the research, not only including clinical trials, but other types of research that have gone on into understanding more about Dravet syndrome. It's to the point where it's a little harder to recruit for clinical trials because not everybody has that seizure frequency that you might need to be admitted to meet the inclusion criteria for a clinical trial. So I think we are seeing a real change on those group of patients, and I expect we'll see the same sort of thing more and more for SC and 8A.
Yeah, I think we have time for one last question here for all of our panelists. So it's kind of a follow-up question to our last one. What does it mean to thrive today versus what it might look like in 10 years? Marianne, what are your thoughts?
Maybe I'll answer that in terms of Brianna and my family. For me, 10 years from now, Brianna obviously would be with us. I would be able to understand everything she's trying to say to me. Whereas right now with her speech challenges, we can surmise, but we don't always know what she's saying. And I know she has a lot of good things to say. So we'd be understanding everything she has to say. She'd be coming close to maybe graduating high school, and maybe the gap doesn't have to be quite as large between her and her peers, and that there's some opportunity for independence. That would be my wish for what I would see 10 years from now, and just not having any seizures.
Yeah, I think that it's a hard reality for our community that the first thing we say is, I hope our kids are here in 10 years. And that's a hard pill to swallow. But I hope that as we look forward, that we have these less emergencies, right? And we talked about that, but just less traumatic events that pop up. So where we feel like we can go on a vacation, or my husband and I feel comfortable to be able to leave for 24 hours to get away from the nuances of life and not be worrying the entire time and glued to my phone that, they might be calling 911 while we're gone. So I think that is really important to think about. Dr. Hughes, what are your thoughts?
So I think beyond the day-to-day of dealing with seizures, one of the biggest things that I would love to see for all of the DE community is change at the societal and advocacy for government support level, so that, for instance, we change the goal of education so that the point is to have lifelong learning and lifelong education, so our kids don't have to meet inchstones or milestones in this moment, because we know that you can gain many skills and you can gain independence and you can gain things over a lifetime, and it doesn't have to be, you know, before you finish high school or before you finish this particular school point. And that those opportunities for independence, the life of your choosing, the ability to have those supports that you need in our community, so that it's not always just you as a parent doing all of the things, or you as your immediate nuclear family doing all of the things, but that we actually have a world that's built to be inclusive of our kids at all of their developmental ages and stages.
Yeah, and not having to fight for it. You know, it seems like we have to fight every inch of the way. So not being able to, not having to fight for it, and it just being there would be nice, right? Dr. Schreiber, we'll move on to you. What are your thoughts on that?
I think these are all great points. I mean, only to add to that, I think seeing more in terms of viable therapies that are out there, and a clear course, you know, how more guidelines in terms of, you know, what someone does when they have an SCN80 diagnosis, more communication with groups like this, with TCSF. So we have a shorter diagnostic odyssey, a shorter route towards being connected with other support and families. Also, as Dr. Hughes said, getting all that appropriate support you need for development in school and everything. And then a more clear path in terms of treatment, right? Not only better treatments and better therapies, and that's what we're all working towards, but a more clear understanding for clinicians, no matter where you're seen. If you're seeing the big center, like one of it, you know, Rochester or Children's National, or if you're seeing any place around the country, you know, that these clinicians have more awareness of, you know, what the best therapies are that are out there. And part of that's on us and trying to figure those things out and define those things. And but it's also about education, getting the word out.
Yeah, definitely. Carolyn, Svetlana, do you have anything to add to that?
I'll just add quickly, because I know we're coming up to the end. In addition to what everybody else has said, and not repeating what I've already said about measurement, I would like to see more new technologies and better access to, I guess, what I call technologies that facilitate independence and communication. So we're not trying to measure, you know, an SCN8A patient against somebody who doesn't have that condition and what normal functioning looks like for them, but really meeting them where they can go, hopefully with great treatments, but then also with these technologies that would facilitate thriving for them.
And I'll just add that, you know, I think we're still learning the basics of this disorder in terms of, you know, mechanism, prognosis, genotype, phenotype correlations. We're so early in this disorder that I hope that, you know, in 10 years, given the research that's ongoing now, the interest that's ongoing now, we really have a better understanding about that genotype, phenotype, how the disease progresses, and you know, have better targets for drug development, because the more that we understand mechanistically, the more successful the precision medicines would be.
Definitely. All wonderful points. Thank you guys so much. So I don't know about you, but I thoroughly enjoyed today's discussion. I know it's very important for families to see the collaboration across so many levels of care. Many times we feel very alone and isolated, like we're fighting this fight alone. But as today has shown, we're not alone. We have amazing clinicians and researchers that are fighting behind the scenes for our kids. This realization alone can be the catalyst for a caregiver to begin that transition from surviving to thriving. So thank you all so much for taking time out of your day to spend it with us. We greatly appreciate the support and all your hard work for our SCN8A community. And once again, thank you, Neurocrine, for being one of our platinum level sponsors for the Meaningful Change educational series. Without your financial support, series like this would not be able to happen. So we appreciate you. Families, don't forget to meet me back here next Wednesday from 12 to 1 on Eastern Standard Time, where we will chat with two amazing physical therapists as we discuss a very important topic, caregiver self-preservation. So how can we take care of ourselves so we can take care of our kids? So we will see you all then. Thank you guys so much and have a wonderful day.
Thank you.
Thank you.
Thanks so much. It's great.
See ya.